Hey everyone, it's Your Name from Zen Zone Health, your go-to for practical health advice you can trust. Today we're tackling a common health concern that plagues millions: sinus infections. Whether you're a seasoned sinus sufferer or just curious, understanding the telltale signs is crucial for knowing when to seek treatment. Stay tuned as we break down the 11 most common symptoms of sinus infections so you can stay one step ahead and feel your best. Let's kick things off with a symptom that's hard to miss, the dreaded runny nose. Now, we've all experienced a runny nose with the common cold, but with a sinus infection, it's often a different story. The nasal discharge tends to be thicker, taking on a yellowish or even greenish hue. You might also experience what's called postnasal drip, where the mucus drips down the back of your throat. Not the most pleasant feeling, right? This happens because your sinuses are inflamed and producing more mucus than usual, trying to flush out those pesky germs. Next up, we have another classic sinus infection symptom: nasal congestion. That feeling of having a stuffy nose, like someone's shoved cotton balls up your nostrils. Yeah, that's the one. The inflammation in your sinuses narrows those nasal passages, making it a real challenge to breathe through your nose. This congestion can be incredibly frustrating, making it hard to sleep, concentrate, and just go about your day. And the worst part, it can last for days or even weeks. Now, if you're dealing with a sinus infection, chances are you're no stranger to headaches. The pressure buildup in your sinuses can trigger some nasty headaches, often described as a dull, throbbing pain. You might feel it most intensely in your forehead, between your eyes, or even in your cheeks and upper teeth. These headaches often worsen when you bend over or move your head suddenly, adding insult to injury. And to make matters worse, they tend to be more prominent in the morning due to mucus buildup overnight. Chapter 4, Bad Breath. Okay, this next symptom might be a bit embarrassing to talk about, but it's important to address. Sinus infections can actually lead to bad breath, also known as halitosis. Remember all that mucus we talked about? Well, it creates a breeding ground for bacteria, and those bacteria can produce some pretty unpleasant odors. So, if you're noticing a persistent bad taste in your mouth or your breath isn't as fresh as it used to be, it could be a sign of a sinus infection. Of course, it's always a good idea to rule out other potential causes with your dentist or doctor. Chapter 5, Hurting Teeth. Here's a symptom you might not expect: tooth pain. You might be wondering, what do my teeth have to do with my sinuses? Well, the roots of your upper teeth are actually located quite close to your sinus cavities. So when those sinuses get inflamed and that pressure builds up, it can actually radiate to your teeth, causing discomfort or even pain. This pain is often felt in the upper rear teeth and gums and can be particularly noticeable when you're chewing or talking. Chapter 6, Coughing. That pesky post-nasal drip we talked about earlier, it doesn't just cause a sore throat, it can also trigger a persistent cough. As the mucus drips down the back of your throat, it can irritate your airways, leading to coughing fits, especially at night when you're lying down. This cough is often worse when you first wake up in the morning and can be quite disruptive to your sleep. Elevating your head with an extra pillow at night might help minimize the drip and reduce coughing. Chapter 7, Sore Throat. Remember that irritating post-nasal drip? Well, it can also wreak havoc on your throat, leading to a sore, scratchy feeling. The constant flow of mucus can irritate the delicate tissues in your throat, causing pain and discomfort that can linger for weeks. You might also experience hoarseness or difficulty speaking clearly due to the inflammation. Warm saltwater gargles can sometimes provide temporary relief from the scratchiness. Chapter 8, Fatigue and Dizziness. Feeling completely drained and exhausted. It's not just you. Sinus infections can really take a toll on your energy levels, leaving you feeling fatigued and run down. Your body is working overtime to fight off the infection, which can be physically taxing. On top of that, the congestion and pressure can disrupt your sleep, making it even harder to get the rest you need. And if that wasn't enough, some people also experience dizziness as a symptom of sinusitis. This dizziness is thought to be related to the inflammation and pressure in the sinuses, which can affect your inner ear balance. One of the more frustrating symptoms of a sinus infection is a reduced sense of smell, also known as hyposmia. When your nasal passages are inflamed and congested, it prevents those odor molecules from reaching your olfactory receptors, which are responsible for your sense of smell. And here's the kicker. Because our sense of taste is closely linked to our sense of smell, a diminished sense of smell can also dull your taste buds. So that delicious meal you've been looking forward to might taste bland and unappetizing. If you have a sinus infection, even the simplest movements can become a pain, literally. Bending over, leaning forward, or even just tilting your head can exacerbate the pressure in your sinuses, triggering pain in your forehead, cheeks, or teeth. This is because these movements can change the fluid dynamics in your sinuses, putting more pressure on those already inflamed tissues. So you might find yourself moving more cautiously and avoiding any sudden jerks or jolts. Last but not least, let's talk about fever. While not everyone with a sinus infection will develop a fever, it's certainly a possibility. A fever is your body's natural defense mechanism, a sign that your immune system is working hard to combat the infection. If you do develop a fever, it's usually low grade, but it can sometimes spike higher, especially if the infection is severe or spreads beyond the sinuses. Keep a close eye on your temperature and consult with a healthcare professional if you have any concerns. So, there you have it, the 11 most common symptoms of a sinus infection. Remember, if you're experiencing any of these symptoms, it's essential to consult with a healthcare professional for proper diagnosis and treatment. They can help determine the underlying cause of your symptoms and recommend the best course of action to get you feeling better soon. From over-the-counter remedies to prescription medications, there are effective ways to manage sinus infections and find relief. Don't let those pesky sinuses get the best of you.